Thanks for watching our final segment in our series, Ask the Doctor. We're talking to UofL Health doctors about the COVID-19 vaccine. We know the vaccine will be available to JCPS educators very soon, so we want to make sure we have a resource where some of your questions can be answered. You submitted hundreds of questions to us. We are posing those questions now to the doctors, so thank you so much for your participation in this. So we are talking now to Dr. Erica Gettis, who is a primary care physician who specializes in internal medicine. So Dr. Gettis, thank you for being here with us.
Thank you for having me.
All right, we got lots of questions to get to, so we will dive right in here. So one of the questions we got is, what happens if I only get the first dose of the vaccine?
So basically the first dose of the vaccination, you will not reach that full efficacy number that is in the literature. So we know from the trials that after receiving the first dose up until 21 days, that about 52.4% of efficacy is going to be reached with the Pfizer vaccination, and more so between 80 and 90% of efficacy will be reached by the Moderna vaccination, comparatively to after phase 3, receiving both dosages, waiting that efficacious period of time. After the second dose, you want full potential. So patient compliance is going to be key. That's always key whenever we have a two-step process in any type of treatment plan. If you're going to get the first one, unless you have, reactions that will increase morbidity and mortality, we do suggest that you get the most out of it and complete the dose series so you can get the most out of the vaccination, which is why it was created.
And what is the full percent effectiveness of the vaccine?
Okay. The full effectiveness of the vaccination for the Pfizer is 95% and 94.1% for Moderna. So with those numbers, those are excellent numbers. It's not 100%. So we still have some room there, but that's definitely greater than most vaccinations now. And it just goes to stand remarkably of our science of our country and coming together to get this pandemic under control and for the health of our nation.
I've heard a few different numbers. So one of the questions that we've got too from our employees is about, after you receive both doses of the vaccine, how much time is it before it takes full effect in your body?
That's an excellent question. So after you receive the Pfizer vaccination, it's a period of time between the first dose and the second dose. You'll have 21 days. After the 21 days, receiving just say the second dose, there's literature say 7-day efficacy, and that's where they got in phase 3 that 95%. So 7 to 14 days people are seeing. With the Moderna, it is 4 weeks, so 28 days between that first and that second dose. So 28 days, and then after which 14 days. So then we're trying to keep it consistent. Just go ahead and say the 14 days after the second dose, then you should say you could reach that 94.1% for Moderna, according to the research that's there.
And so you say that it's not 100%, so there's some things that we still need to do. So even after receiving the vaccine, will people still need to wear masks?
Absolutely. The mask was created for a purpose, and that purpose was to help decrease the spread of this virus, and it still wouldn't be needed to be. So the mask is going to be needed.
And so will people develop COVID-19 symptoms after receiving the vaccine?
No, not COVID-19 symptoms, simply stated an immune response. So those are overlapping, as a lot of the questions during this period of time when we went into flu season is, do I have flu? Is this my allergies or sinus is acting up? Or is this COVID? Because a lot, viral syndromes and just common cold viruses, rhinovirus, adenoviruses, those viruses are still there. They didn't go away. They're just not front line or in discussion at this time. It's the current coronavirus. So with that being said, no, the fatigue, malaise, maybe a fever, you may mount some of those responses. Everyone is different. Of course, injection site as well may have some tenderness within that arm, headache, and so forth. But actually COVID, specifically symptoms, is not well documented to say that kind of outliner where people are moving towards the taste, the loss of taste and smell that kind of delineates a little bit on some of the commonalities versus uncommonality symptoms. You should not
And Dr. Gettis, thank you for answering our questions from our JCPS team members. It's been an important conversation to have, and we appreciate your time and your insight and your knowledge and letting us know. And again, if you have a particular question about your circumstance, we encourage you to please talk to your doctor, your primary care physician, if you have specific questions for your individual needs. So Dr. Gettis, thank you for being here. Thank you to UofL Health for being a part of this video series. We hope this has been helpful to you. We've learned a lot throughout this series. So thank you for watching. I'm Renee Murphy.